Welcome. I am Dr. Lori Erickson, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the May 2013 print journal. This month's Editor's Choice is the commentary, Trust in Residents and Board Examinations, When Sharing Crosses the Boundary, which was authored by Dr. Gregory Runke from the University of Chicago and Dr. David Dukas from the University of Louisville. They discuss the problem of illegal reproduction and transmission of board certification examination questions and the suspension or revocation of certification of 139 physicians that were found to be disclosing or soliciting questions for a board review company. The accompanying editorial, Professional Responsibility in Certifying Examinations, authored by Dr. Christine Castle, Dr. Eric Holmboe, and Lori Stass from the American Board of Internal Medicine, Philadelphia, Pennsylvania, is also featured on the cover of Mayo Clinic Proceedings. Another featured highlight article is an original article entitled, Day of Surgery Consenting for a Perioperative Clinical Trial Does Not Reduce Patient Understanding of the Protocol Nor Worsen Anxiety, authored by Alexandria Chudzinski and colleagues from Cleveland Clinic and McMaster University. They found that recruiting patients the day of surgery as compared to prior to the day of surgery did not result in decreased understanding or increased anxiety or in perceived obligation to participate in the trial. The accompanying editorial, Fixing Human Subjects Protection in the U.S., Moving Beyond Consent, was authored by Dr. Barbara Koenig from the University of California, San Francisco. Dr. Koenig discusses the informed consent process as studied in the article by Chudzinski et al., which focuses on the process of same-day informed consent. This editorial also discusses another article in this month's Mayo Clinic Proceedings, Increasing Enrollment in Clinical Trials, Greater Transparency about the Social Value of Individual Clinical Trials Deserves a Role in Recruitment Efforts, by Dr. Yarbrough, who proposes requiring the disclosure of the relative social value of a clinical trial as part of the initial informed consent process. This month's third featured highlight is an original article entitled Cardiovascular Fitness and Mortality Following Contemporary Cardiac Rehabilitation, authored by Dr. Billie Jean Martin and colleagues from the University of Calgary and colleagues from the University of New Mexico and the University of Alberta. In retrospectively studying over 5,600 patients, they found that in contemporary cardiac rehabilitation patients, higher baseline fitness predicted lower mortality. They also found that improvement in fitness over a cardiac rehabilitation program and improvements that persisted at 1 year were also associated with decreased mortality, most strongly in patients who start with low fitness levels. This month's fourth featured highlight is a review article entitled The New Oral Anticoagulants in Clinical Practice, authored by Drs. William Gonsalves, Rajiv Pruthi, and Renault Patnaik from Mayo Clinic in Rochester, Minnesota. The authors provide a review of recent FDA-approved oral anticoagulants, such as dabigatran, rivaroxaban, and apixaban, describe the main studies that evaluated these drugs and their pharmacokinetic and pharmacodynamic properties, and provide a practical approach to their clinical use. The original article entitled Risk of Colorectal Cancer After Colonoscopy Compared with Flexible Sigmoidoscopy or No Lower Endoscopy Among Older Patients in the United States, 1998 to 2005, was authored by Drs. Yiz Wang, John Kangemi, and Michael Pico from Mayo Clinic Jacksonville, Florida, and Dr. Edward Loftus from Mayo Clinic Rochester, Minnesota. They compared the risk of colorectal cancer after colonoscopy with sigmoidoscopy or no lower endoscopy in patients 67 to 80 years old. They found the risk of distal colorectal cancer decreased both after colonoscopy and sigmoidoscopy, and the risk of proximal colorectal cancer decreased after colonoscopy, but not sigmoidoscopy. The review entitled Childhood Food Allergies, Current Diagnosis, Treatment, and Management Strategies for Primary Care Physicians was authored by Dr. Ruchi Gupta from Lurie Children's Hospital of Chicago and colleagues from several other national healthcare institutions. The review addresses the definition and mechanism of childhood food allergy, differences between food allergy and intolerance, the epidemiology of childhood food allergy, management of food allergies, emerging treatments, and future directions in food allergy research and practice. Video interviews are available with authors or co-authors of the articles on trust in residents and board examinations when sharing crosses the boundary, increasing enrollment in clinical trials, cardiovascular fitness and mortality following cardiac rehabilitation, mortality predictability of body size and muscle mass surrogates in hemodialysis patients, the new oral anticoagulants, and childhood food allergies. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Many more videos, indexed by journal issues and by themes, but also freely searchable, are available on our YouTube channel at www.youtube.com/Mayo Proceedings. Also on the website are series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff. This month features Dr. Ruth Weinstock. Dr. Weinstock is Distinguished Service Professor at the State University of New York. Dr. Weinstock is the founder and medical director of the Upstate Joslin Diabetes Center, professor of medicine specializing in endocrinology, diabetes, and metabolism, and research professor of neuroscience and physiology. She is the medical director of the Clinical Research Unit and Division Chief of Endocrinology, Diabetes, and Metabolism. As you well know by now, you can find on our homepage a number of online-only features that are not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Also, please follow us on Twitter at www.twitter.com/Mayo Proceedings to learn about online first publications in Mayo Clinic Proceedings and newsworthy developments related to our journal. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and other outstanding articles in the May 2013 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the June 2013 issue of Mayo Clinic Proceedings will contain articles on diagnosis of celiac disease, family history of chronic disease and meeting public health guidelines for physical activity, association between obstructive sleep apnea and pulmonary embolism, among many others. Our June issue will go live on our website on June 1st, 2013.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.